just like to introduce you to the gentleman sitting in front here. In the middle is Lieutenant Arif Abu Shata. He's the Group MD of Duopharma Biotech Berhad. On his right is Encik Wan Amir Jeffrey Wan Abdul Majid. He's the Chief Operating Officer. And also on his left is Mr. Chek Woo Kiong. Yeah? He's the Chief Financial Officer. So, to start the ball rolling, maybe Mr. Leonard, you would like to brief us what's happening this morning?
Okay, Assalamualaikum warahmatullahi wabarakatuh. And let me, on behalf of Duopharma Biotech Berhad, welcome all members of the press and media. As you'll be aware, we had the 18th annual general meeting for Duopharma Biotech Berhad today with various resolutions. So happy to announce that all resolutions were carried with strong majorities. Inclusive of the recommended dividend. We've declared a dividend of 4 cents per share as the final dividend for 2018. And at the same time, we've also announced that we will be doing a dividend reinvestment plan relative to the dividend that we're declaring, the final dividend, the 4 cents per share. The meeting went well, obviously somewhat delayed finish, mainly because of the level of questions that were brought up by the shareholders, which surrounded very much from a business perspective. As you are aware, Duopharma is involved in the healthcare industry. So a lot of the questions revolved around the size of our government business. Is there going to be a change? Are there risks, etc., etc.? So we covered most of the issues with the shareholders, hopefully to their satisfaction, and we're open to any questions that the press may have. There's a separate press release that I believe has been provided to all the media representatives, but I'm happy to take questions. Either you want clarification of what's in the media release, or if you have questions outside the media release, happy to address at this session as well.
Members of the media, questions please.
Yeah, please.
From the Edge. You've mentioned the shareholders were asking about the size of the government business. Yeah, can you share your breakdown of between your contracts with the government and the private hospitals?
Okay, generally speaking, let me cover private and government. But private will include our consumer healthcare and our export business. That means, let me call it the non-government side. So total government business at the moment is approximately 51% of our revenue base, so that's value based. The other 50% is the private sector, is divided between hospitals, GPs, pharmacies for the ethical products, and then we have a large consumer healthcare product, and then we have the export side as well. But having said that, I think most people have to realize that the biggest consumer of generics in Malaysia is the government of Malaysia. Out of total generics consumed in Malaysia, it's estimated that the government consumes almost 70%. Okay, so at 50% of our total turnover, we still believe there is upside potential, even within the government sector.
Is there any plan to change the
I think
the current
the main plan at the moment is to improve the level of exports that we're doing, rather than looking, because as I said, that as far as our penetration into the government sector, it's still below what the government's actually consuming as a total. But we are cognizant from a risk mitigation standpoint, we want to balance all our markets, be it government, private or exports. In the past, we've actually indicated that we would like to have a third. Would be the ideal so-called balance for Duopharma, a third government, third private, and a third exports. That would be the ideal portfolio balance that Duopharma would eventually target.
It was mentioned in the press release that you penetrated 4 new markets. Yeah. You plan on exploring further new markets?
Oh, definitely. All 4 markets were in the African subcontinent, apart from, I think, Qatar. We are exploring other markets, but it's a bit of a chicken and egg, because you have various regulatory authorities. So each country has its own regulatory authority, and sometimes they implement their own specific requirements that are not common. So a lot of our effort at the moment is being spent upgrading existing dossiers to meet standards that will be more applicable across countries. So if you can imagine, Malaysia has a certain requirement, but other countries may have slightly different requirements. So we need to get our dossier developed so that it's acceptable in multiple countries. So that's where a lot of effort is being done. But we're seeing early successes like these 4 countries. So but the answer is yes. We are definitely looking, because if you go back to as I said, the balancing of the portfolio, we need to grow the export portion. In fact, if you look at the export portion, it's not as a percentage of our total portfolio. Last year, it's only 8%. In a few years back, it was actually at 10%. And it's not because it's reduced; it's actually grown. It's just that as a percentage of total portfolio, the other sectors have grown faster.
How about ASEAN? What's your outlook on ASEAN? Your plans in ASEAN?
Still very positive. ASEAN tends to be our primary area of focus in our expansion plans. For those projects that we've announced publicly, for instance, the erythropoietin EPO, and also with the stem cell company we recently invested in, our primary interest is to have marketing rights for ASEAN, because that's where we see our strengths to be. Obviously, we would take opportunistic exports outside of ASEAN, but focus still remains ASEAN. So we still remain bullish on the ASEAN pharmaceutical market. What we're hoping for is more harmonization in terms of regulations within the ASEAN countries, in order to have so-called the one-stop dossier can be registered across all countries. That's still one of our major wish lists. Any other questions?
Another question from this side?
Yes,
I'm
please.
Shah from Malaysia Reserve. Just want to check. I think, correct me if I'm wrong. Earlier this month, the government has made a decision between the health ministry and the KPN on this pricing issue of pharmaceutical products, whereby they plan to regulate the pricing. So, do you have any thoughts on that? Any concerns?
Okay, I mean, you're talking about price control. Okay, I tend not to agree personally to price control, because I think having an open market and allowing pure competition to take place is the best means of price control. Okay, so we have always been for the introducing of more competition as opposed to controlling things at the price point. I think majority of products that will probably be affected under the price control will most likely be those products that are still under patent. Okay, effectively more innovator-led products rather than generics. So at this stage, I don't see, because in the generic side, you have a tender system because there's no monopoly. So the tender system creates the price competition. I think the issue with the Price Control Act is when you talk about innovator products that are still under patent, how do you manage what is a fair pricing? And when I say fair to the innovator as much as to the consumer.
Also, now with the ringgit is kind of weakened, so how has affected your business so far? Do you have
Pharmaceutical business, not only Duopharma, all the pharmaceutical players in Malaysia will similarly be affected. There's no fine chemical industry in Malaysia, so a lot of us are importing our raw materials from overseas, be it Europe, China, India, or US, and generally it's all denominated in USD. So out of our cost of goods sold, fair to say 40 to 50% is actually subject to USD fluctuations. But having said that, 50% of our business is into the government sector, and the last time we entered into the government sector tender, the exchange rate was also 4.2, 4.3. So we're not operating in what I would call unusual circumstances. If anything, by virtue of our experience over the course of the last 4 to 5 years, we've seen exchange rate go up and go down. So we're still within an area that I think is tolerable. But obviously, we would hope for the ringgit to appreciate.
You mentioned, it's Stephanie from Focus Malaysia. innovator-led versus generic. What kind of your portfolio is there? Can you give us like a what percentage?
Okay, generally speaking, if you look at it by volume, the market is roughly 70% generic, 30% innovator by volume. You reverse that if it's by value. If by value, innovator is about 70% of the market and generic is about 30%. Okay. Now, if you look at the top 10 pharmaceutical companies in Malaysia, by volume, Duopharma is the largest. But by value, we are only the second, the first being Pfizer. In fact, most of the companies in the top 10 in Malaysia by value tend to be foreign companies. Okay, so we were third until fourth quarter last year, we became the second largest. But yeah, that gives you an idea about the disparity of pricing versus volume. 70-30 and you can split. Yes.
Hi, it's Ali from Berhad. Since 2016, Duopharma has allocated about 350 million for CAPEX. So, is that a specific amount for 2019 or 2020?
Okay, the 350 over million was over a period of time, and it was supposed to be fully spent by 2020. But now we've extended it due to various reasons, so we think that the final drawdown will only occur in 2021. So the 300 million was intended for a few projects, one of which was the effervescent project, which has already been commercialized. The second was for our oncology facility that has already been validated. We're now awaiting regulatory approval that will commercialize probably Q4 this year. Another portion of it was to set up the first pre-filled syringe line for biologicals in Malaysia. That most likely will be up and running by Q4 this year. An additional was to upgrade our Bangi facility warehouse, what we call Bangi 3, to build an additional warehouse in Klang. That will most likely will get the certificate of CCC by end of this year. The only thing left outstanding, what I call the chunkier item, is the K3, the new facility in Klang. That has been pushed slightly due to various issues, but the rest is more or less been spent and we're starting to draw down, which is why our interest costs in 2018 and 2019 are actually on an increase. So gearing levels at the moment has gone to 0.51. We were circa 0.3 last year. The year before last, we went up to 0.451 for 2018. We think by the time we fully draw down all loans, we'll be operating at circa 0.8 times in terms of gearing levels.
Any other question?
You mentioned competition just now. There's been talks in the market that Duopharma may have been monopolistic in nature. Have you been approached by the Cabinet Committee on Market Monopolies or Malaysian Competition Commission?
Majority, almost all our contracts are won on open tenders. So we haven't, in answer to your question, we haven't been approached. We have our own view as to what the current government can do to obviously improve the process of supply. And obviously, if approached, we will share that gladly. But I think we have been quite successful in regards to being able to be competitive in majority of, well, most of our tenders. All our tenders are actually multi-parties anyway. So I can't think of anything that we have a monopoly over. In fact, there is nothing. Nothing we have a monopoly over, I wish.
Can we get an update on the GST refund that you were...
Oh, let me pass this. I kind of expected that question.
So far, we still have around 8 million that we have not collected back. We have not been refunded.
So the government has paid 2 million?
No, the outstanding amount is around 8 million.
Okay.
We have not been refunded.
Is there any update from the government?
We are following up with them.
Okay.
Is there any target by when they will like
Earlier better.
earlier better?
I only speak from a cash flow perspective.
Okay.
No, but having said that, discussions have been taking place. So they've come and done some audits, etc.
Yeah,
So,
audit has been done actually.
so we're hoping that we'll receive the refund, as I said earlier, rather than later.
So the amount right now is 8 million.
8 million, yeah.
Last week we announced your Bursa can say that your plans to expand its specialty products and meet the rising healthcare demand in the country, but no, you want that the profit could be dented by the rising US dollar. Maybe you can elaborate further on that. Any particular product?
We were the we were the first company to register a biosimilar monoclonal antibody. It was a product called trastuzumab. We entered into the government tender. We dropped the price by half, but the innovator dropped the price by 52%. Okay, right? So we lost the tender. Right? So it can be rather frustrating at times that we try to do things to bring down the price, but then you don't get rewarded for it because somebody who's been charging a very high price can just drop the price and still retain the business. So that's what I explained about the specialty business. Having said that, that was government, but that business we're now penetrating the private sector. So I go back to the earlier question that we cannot be over-reliant on any one sector. So not winning the government tender in this situation was not do or die for us. We just launched it aggressively in the private sector. Yeah. And now you have a funny situation where in some cases private sector is selling cheaper than government sector. The US dollar, as I said, the pharmaceutical industry generally is heavily exposed to the US dollar rate. Now, we do have a natural hedge because we export about 10% of our goods, and those exports are occurring in US dollars as well. But you're talking about 10% of sales, which is approximately, let's say, 40 to 50 million ringgit worth of USD, but the consumption level is
Our consumption level is around 200, slightly above 200.
200 worth. So we only have a natural hedge for about 20 to 25%. So the other 75%, it doesn't only apply to Duopharma, it applies to any pharmaceutical company. So generally we have about a 75% exposure. So one of the issues that we have is, in addition to the exposure on our raw material, we also have financing lines that are US dollar denominated. So one of our plans is to try to reduce the amount of foreign currency denominated facilities that we have as well.
So the outlook for this year, you think you could do better than last year?
The answer, this is a question that all the analysts ask me, and I always give them the same answer. My board of directors will never allow me to produce lower numbers than the previous year. Read what you want into that.
So I say we hope to do better.
We hope to do better, definitely.
Do you think it's a challenging environment?
Oh, that's a tough question, because we're involved in the healthcare side. For us, market demand tends to be quite stable, especially because we're involved in the generic side. So if you're ill, you're ill. Okay, whether you go to private or government, because of our split in portfolio, whether you go to a private institution or you to go to a government institution, we're still able to supply the product. So in that sense, healthcare tends to be a little bit more resilient as an industry relative to some of the others. But the only downside for us is our over-reliance on imported material, and we have no choice. The whole industry has no choice. So if I think one of the buzzwords at the moment tends to be healthcare inflation. Okay, and healthcare inflation has a direct correlation to the strength of the ringgit. The stronger the ringgit, the cheaper your production of the pharmaceuticals. The weaker the ringgit, then you can expect to see pharmaceutical prices going up. Okay? That's just the reality. But having said that, as I said, that when we entered into the current round of government tenders, the exchange rate was circa where we are now. So it's not as if we are shocked by the current level, obviously, but we want the ringgit to appreciate as fast as possible.
What about margins? Any concerns of tightening of margins?
I mean, once your cost goes up, obviously, because the nature of the business that we have, 50% is supplied to the government. Those are all on tenders, contractual basis. So those are lock-in prices. So what happens is, if the ringgit depreciates or US dollar appreciates, it becomes more expensive to sell or to buy raw material, but our selling price is lifted. So you find that, but it's a double-edged sword, you know, because I think similarly, if the ringgit appreciates, the government doesn't come back and renegotiate its contracts. It's a fixed contract, so it cuts both ways.
Okay, one last question, maybe.
Anything other outside your raw material prices that you can do to sort of help those margins, efficiency?
Yeah, efficiency is one major area. We've been involved in Lean Six Sigma for a number of years. In fact, last year we achieved savings at a cost of goods level, probably at around about 7.7 million, whereas target was 6 million worth of savings. So yes, we can. But certain things is very difficult to create savings. I mean, like manpower, obviously we want higher efficiency. But having said that, the trick is to mechanize, except the Malaysian market, relative to international markets, pharmaceuticals, is actually quite small. So you find that facilities are not as automated as they could be. So as a result of that, cost of production sometimes is slightly higher than even overseas. So it's manpower cost and raw material cost tends to be the two major contributors to the goods. So you can't do much on manpower apart from increasing some level of efficiency, and your raw material is very much USD dependent. So yes, we can, but we are limited somewhat.
Okay, and the mechanization, is it just not worth it from the economies of scale? So
Yeah, it's basically scale tends to be the biggest issue. We, in fact, back in 2010, we put up the largest IBC, or we call it intermediate bulk containers for manufacturing of tablets. It was the first time there was a 1 ton raw material machine. But we found we could hardly use it, mainly because there were not that many products available in the market that required that level of raw materials. It's scale, which is why the export business becomes very, very key, because at 32 million population, we are relatively small. So we need to have a wider international footprint, and that's really what we're targeting for.
that leads into your ASEAN.
That leads into the ASEAN strategy, etc. But you can't do it without having a unique proposition. You know, gone are the days when you can say my product made in Malaysia is better than that product made in an ASEAN country, because standards have all come up. So in effect, it's production capability, production scale, and uniqueness of proposition becomes very, very key. So that's one of the reasons where we're one of the first companies in ASEAN to really start looking at biologics and biosimilars, and that was the strategy behind it.
Okay. Do Duopharma got any new product in hands going to launching soon? Or okay, second is the overseas market. It seems like how many in hands already, and then your target is penetrate how many more country in looking forward on how many years on that. And then third one is the operation and marketing, because you plan to overseas or new product launching. So what is the allocation on it?
Okay, I'll work backwards because the last question is the one I remember. You might have to remind me on the others. Okay, primary markets at the moment, export is Indonesia, Singapore, and both of which, Philippines and Singapore, both of which we have offices in already. We have a rep office in Indonesia, and we're evaluating the possibility of having a rep office in another ASEAN countries. So generally speaking, our route to market is through distributors. Okay, it's not personal presence, because the products are all manufactured in Malaysia, and then we just use distribution channels in the respective countries. So we may be involved as the license holder, but we may not be the actual distributor. So the offices manage the distribution. So at the moment, as I say, the primary markets, we have offices. We're now considering another office in another ASEAN country. As far as registrations, obviously we participate in international conferences on an annual basis. So we have various ad hoc requests during these conferences to supply certain goods, and if our products can be registered in those countries, then we proceed. But the process of registration, especially in foreign jurisdictions, can take as long as 36 months. So even these 4 countries we just got, work was started nearly 3 years ago.
Yes. Yeah, that's why I'm asking how many more.
Yeah,
in
well, no,
hand,
we're
right?
working. We actually, it's an ongoing registration process for many countries. It's a question of what size the market relative to the cost of registration. So that is ongoing. So you can be assured on every year there'll be at least 2 or 3 additional countries that we will add on, subject to getting the registrations as well. What was the first question?
All right.
New
New
products.
product, yes.
Okay. New products. I mentioned a few just now. Trastuzumab, which is a product intended for breast cancer, that has been launched already. Erisa, obviously, we got the registration in January, so that has also been launched in the Malaysian market 8th of April. At the moment, we have, on average, if the timelines for registration are correct, we will have on average 4 to 6 products every year. Okay, manufactured. Traded products may be 2 every year. Okay, the next one we're hoping is after we've got one product which has been importing, but we are going to manufacture in Malaysia for the first time. It's a product called Letrozole for oncology. So that's the first product that's going onto our oncology facility. And we are developing 2 new products which previously would have been imported that we want to manufacture in our oncology facility as well. So all in, you're talking about potentially anything between 6 to 10 products. You have to be careful about launching of new products because the cost of development of a new product is easily ringgit 1 million, easily, per product. So when I say that 10 products are being launched, effectively it means I've spent 10 million ringgit on 10 products. So some people ask, well, why so little? But it's a large cost. It's a large cost. So we need to balance our capability, market acceptance with the cost of investment as well.
Okay, okay. Can I update on the new 2 product already launched? What is the performance now, or what is the looking forward plan now?
I'll touch upon Trastuzumab and also Erisa. Erisa is our EPO. At the moment, it's still being imported from Korea, but we intend to locally manufacture the product by end of this year through a fill and finish facility. The product has already achieved registration. We've already participated in the government tender. Results are not out yet, although we do know that we are the lowest price, okay, in the tender. So we hope to hear something within the next 60 days. Now that total tender value is approximately for 2 years about 20 million. Okay. Then separate to that was Trastuzumab. Trastuzumab was a tender that we entered into, but this is the one we dropped by 50, but because the originator dropped by 52, we lost. So we've already launched it into the private sector market already, and that is providing quite good. The total market size is about 20 million. So, but that is in totality. So I think we will try to get as much of that within the first year of launch. The other thing about Erisa, we've also got permission for Erisa to fall under the government subsidy system. The government provides a subsidy for renal patients, depending on where you get your hemodialysis treatment. So we recently got approval for Erisa to be part under the government subsidy system as well.
Okay, thank you so much for all your questions. For the benefit of photographers, gentlemen, we need you to post with the report.